What is precordium? What's the meaning of precordium? So precordium, very importantly, this picture, this box is known as precordium. This box is known as precordium. What is precordium? Precordium is the anterior chest wall overlying the heart. Anterior chest wall overlying the heart. That is known as precordium. So in the cardiology, everything revolves around the heart, so around the precordium. Simple one-liner question: what is precordium? It is the anterior chest wall overlying the heart. जहाँ पे दिल है, वो वाला हिस्सा, that part is known as precordium. Also, one very basic question: if I ask you, right heart border is formed by what, and left heart border is formed by what? Very simple, very easy. Right heart's right side, no, we all know that we have superior vena cava. Down we have inferior vena cava, and above we have the right atrium. So hypothetically, just imagine superior vena cava, it enters the right atrium, and down we have inferior vena cava. So right heart border, please remember, it is formed by superior vena cava, right atrium, and inferior vena cava. So now two happy questions are over. What is precordium? It is the anterior chest wall overlying the heart. And what is the right heart of the border is formed by what? It is superior vena cava, right atrium, and inferior vena cava. What about the left border of the, so right heart is done. So left heart border, yes. Now who will tell me? Left heart border is formed by what? If I show you a picture of the left heart border, so this side, this is the left side of the border. What all you can see in the left side of the border? Right side of the border, I saw superior vena cava. Right side of the border, I saw the right atrium. And right side of the heart, I saw the inferior vena cava. Photographic memory, photographic. So right heart border, beautifully done. What about the left heart border? Now, left heart border, I can appreciate the aorta. I can appreciate the left atrial appendage, because this side we have the right atrium. So this side will have the left atrium. So the best answer for this question, we have arch of aorta, descending aorta, pulmonary artery, left atrial appendage, and left ventricle. So simple words, whatever is there on the left side, no, arch of aorta, descending aorta, pulmonary artery, left atria, and left ventricle, like left atria appendage and left ventricle. Finish. Now, very importantly, tetralogy of Fallot. Tetralogy of Fallot. Now, what are the components of a tetralogy of Fallot? So, tetralogy of Fallot, number one, if I draw a picture over here, so we all know this is the four-chambered structure of the heart. We have right atrium, right ventricle, left atrium, left ventricle. Yes or no? This PA is known as pulmonary artery, and this is known as aorta. So we have the pulmonary artery and the aorta. So we all know the components of tetra. Tetra means four defect together. What are the four problems we'll have? Number one, the patient will have right ventricular hypertrophy. The patient will have right ventricular hypertrophy. Then what else the patient will have? So the patient will have right ventricular hypertrophy. Now P for, very importantly, pulmonary stenosis. P for pulmonary stenosis. I'm telling you the simple things first, then the difficult ones. And the patient will have a ventricular septal defect. The patient will have a ventricular septal defect, and the patient will have a overriding of aorta, and the patient will have a overriding of aorta. So these are the four problems are there in tetralogy of Fallot: right ventricular hypertrophy, pulmonary stenosis, ventricular septal defect, and overriding of aorta. Overriding of aorta, in simple words, if I talk about, like, the aorta is not beautifully placed at its location. Little bit it has come like a overriding. Aorta थोड़ा सा अपनी normal जगह से हट गया है. The aorta from its normal position has shifted little bit on the other side, and that is why now this overriding of aorta, this is a reason for right ventricular hypertrophy. Listen to me very carefully. Hello. Right ventricular hypertrophy, the reason for right ventricular hypertrophy is not pulmonary stenosis. The reason for right ventricular hypertrophy is nothing but overriding of aorta. Just remember, in general, we have the VSD, no? Just now I told you ventricular septal defect. So this VSD, in a case of tetralogy of Fallot, it's a very large VSD. It is a very large VSD. So whatever blood is coming from superior vena cava to the right atrium to the right ventricle to the left ventricle, and from the left ventricle, the blood is going to the aorta. Now here, when the blood is going to the aorta, there is a kind of a aortic problem known as overriding of aorta. Like the path is not so beautiful. The students who have come from right atrium to right ventricle to left ventricle and to the aorta, while passing to the aorta, these students were having little problem because the door was not proper. There was a overriding of the door, and that is why, like, kind of a back pressure, the back pressure is going to happen, and that is why we have a right ventricular hypertrophy, RVH. So in one liner, right, when questions I go, number one, what is, let's revise. Revision plays a very important role. Revise till you die. Number one, what is precordium? It is the anterior chest wall overlying the heart. Second question, right heart border is formed by, the answer is right atrium, superior vena cava, right atrium, and inferior vena cava. And third question, overriding of aorta, it's because of the because of the overriding of aorta, there is right ventricular hypertrophy. I'll repeat again, right ventricular hypertrophy, the reason is overriding of aorta. Finish. Next question. As the patient has pulmonary stenosis, so we all know this is the pulmonary artery and this is the pulmonary stenosis. Pulmonary stenosis, or some books have written RVOT. RVOT. So what is RVOT? RVOT is right ventricular outflow tract obstruction. Right ventricular outflow tract. Right ventricular outflow tract obstruction. Nothing but obstruction at the pulmonary area or at the pulmonary valve. So I'll tell you the simple words and little difficult words. So pulmonary stenosis, the book has the Park Cardiology has not written directly pulmonary stenosis. It has written right ventricular outflow tract obstruction. What level of obstruction? I'll tell you. Right now, this is something basic you need to know. Okay. So this part is done. Everything is done. Okay. If I ask you a very simple question, which is the most common cyanotic congenital heart disease beyond infancy? Beyond infancy, the most common cyanotic congenital heart disease, the answer is tetralogy of Fallot. So we all know that tetralogy of Fallot, it is a cyanotic congenital heart disease. Why? Why it is a cyanotic congenital heart disease? Why cyanosis is there in tetralogy of Fallot? So we all know that when the blood normally comes from to the right atrium and from right atrium to the right ventricle, from the right ventricle in tetralogy of Fallot, there is a very big VSD. So the blood is going from right ventricle to the left ventricle. Like, so naturally, the blood is not going to the pulmonary artery because there is a pulmonary stenosis. Because there is a pulmonary stenosis, rasta band hai, door is locked. So when there is a pulmonary stenosis, then naturally lungs are not available for the purification of blood. Normally, the blood is going to the pulmonary artery and to the lungs. But here we have pulmonary stenosis. That is why the blood is not going to the lungs. The channel, the path of the lungs is blocked. And that is why the purification process is not going to happen. And that is why the patient is going to have a cyanosis, or you can say it is a cyanotic congenital heart disease. But if I say cyanotic congenital heart disease at day of life 1, can you answer in the comment section? 1 day old baby cyanotic, then what is the most commonest answer? So the most common cyanotic congenital heart at day of life 1, that is nothing but TGA. If the baby is a 1 day old cyanotic, then the answer is TGA. What is TGA? TGA is transposition of great arteries. TGA, it is a transposition of great arteries, that is known as TGA. So I'll repeat again very quickly. The most common cyanotic congenital heart in a 1-day-old baby, it is TGA. And the most common cyanotic congenital heart disease beyond infancy, as in a 6 months old baby, one year old baby, the most common cyanotic becomes tetralogy of Fallot. Finish. Next question, please. So this part we have done. Okay. So yeah, and which is the most common congenital heart disease in full cardiology, full cardiovascular system? If I talk about which is the most common cyanotic congenital heart disease in full cardiology, so that we have done that. So most common congenital heart disease in full cardiology. The most common congenital heart disease in full cardiology is a VSD. Examiner here has not asked cyanotic or acyanotic. Examiner is asking which is the most common congenital heart in full cardiology. The answer is VSD. The most common cyanotic at day of life 1 is TGA. Otherwise, it is TOF. Done. So these questions, these parts, beautifully done, done, done. Yes. Now we have trilogy, tetralogy, and pentalogy of Fallot. These three also very basic stuff, but must know for the exam purpose. So we have trilogy, tetralogy, and pentalogy of Fallot. So we have the four-chambered structure of the heart: right atrium, right ventricle; left atrium, left ventricle. This is the pulmonary artery, and this is the aorta. What is trilogy of Fallot? Trilogy, three problems. So trilogy, three defects altogether. Any idea what do you call that? Like as in what are the components we have? Yes, in trilogy of Fallot, imagine I am a rapper, R-A-P, rapper. So R-A-P, rap is the mnemonic for trilogy of Fallot. R for right ventricular hypertrophy, R for right ventricular hypertrophy, A for atrial septal defect, A for atrial septal defect, and P for pulmonary stenosis, P for pulmonary stenosis. So R for right ventricular hypertrophy, A for atrial septal defect, P for pulmonary stenosis. Tetralogy of Fallot we have done. What is pentalogy of Fallot? In pentalogy of Fallot means 5 problems. All the 4 problems of tetralogy of Fallot plus the 5th problem is the atrial septal defect. In penta means 5 problem, means all the 4 problems of TOF plus a atrial septal defect. Please remember atrial septal defect, it is seen in trilogy of Fallot and pentalogy of Fallot, but in tetralogy of Fallot, you don't see a ASD, you see a VSD. So this is very important for exam purpose, that atrial septal defect, it is seen in trilogy of Fallot and pentalogy of Fallot. Now, very importantly, tetralogy of Fallot. Let's do it again. We all know tetralogy of Fallot. We have right ventricular hypertrophy. We have pulmonary stenosis. So I'll write here right ventricular hypertrophy, pulmonary stenosis. We have a VSD, that is ventricular septal defect, and we have a overriding of aorta. Overriding of aorta. Now, one more thought process must appreciate for exam purposes, that reversal of shunt is not possible in which congenital heart disease? Reversal of shunt is not possible in which congenital heart disease? Now, what is the meaning of reversal of shunt? The meaning for reversal of shunt, that means something in the beginning was left to right and over a period of time became right to left. Reversal, R for reversal, R for right to left. For example, ASD, VSD, and PDA, all these conditions are left to right shunt, and over a period of time they can become right to left. So reversal of shunt can happen in a case of ASD, VSD, PDA, but they can never happen in a case of, and the answer for this question is tetralogy of Fallot. Listen to me very carefully. The question was reversal of shunt is not possible in which congenital heart disease? The answer is tetralogy of Fallot. What is the meaning of reversal of shunt? The meaning of reversal of shunt is nothing but a shunt which was in the beginning it was left to right and after some time became right to left. For example, we all know ventricular septal defect. If I talk about a VSD, we all know, if I talk about only VSD, okay, ventricular septal defect, we all know VSD as the left side of the heart has a higher pressure. If this is a VSD defect, it will always and always be left to right. Because naturally, if this door is broken, the water will come from left to right only. Why? Because the left side of the heart has a higher pressure than the right side. So when more and more students, the more and more blood will go from left to right. So means more and more blood enter to the pulmonary artery. Yes or no? Because from superior vena cava and inferior vena cava also, normally the blood is entering the pulmonary artery. Now from the left side to the right side, the blood is entering the pulmonary artery. So I can say in this condition, there is increased pulmonary artery blood flow. When there is increased pulmonary artery blood flow, when too much of blood is going to the through the pulmonary artery from the superior vena cava side also and from the VSD side also. When too much of blood is going through the pulmonary artery, eventually pulmonary artery will get fatigued. Eventually pulmonary artery will get tired and the patient can land up into pulmonary stenosis. The patient can land up into a complete block of pulmonary stenosis. So the shunt, which was left to right in the beginning, becomes right to left. The shunt becomes right to left. That is known as Eisenmenger syndrome, which is definitely possible in a case of ASD, VSD, PDA, because ASD also same story, and PDA, which is between the pulmonary artery and the aorta, PDA, here also same story, left to right shunt followed by right to left. Now, very important, reversal of shunt is not possible in tetralogy of Fallot. Why? Sir, I will not cram, sir. You tell me, in tetralogy of Fallot, why reversal of shunt is not possible? Reversal is possible. Why it is not possible? Because the patient is not just having only VSD. There is a VSD with the pulmonary stenosis. There is a VSD by birth, but by birth, there is also a pulmonary stenosis. So as by birth, I have a pulmonary stenosis with VSD. So by birth only, the direction of the VSD, it is a right to left shunt. It is a right to left shunt. ASD, VSD, PDA individually, they all are left to right shunt. Whereas in tetralogy of Fallot, there is a VSD with pulmonary stenosis. So the shunt of VSD was never ever a left to right. It was always by birth, it was right to left. That is why reversal or Eisenmenger syndrome is not possible in tetralogy of Fallot. So this is a very important exam point of view question, that reversal of shunt is not possible in which congenital heart disease? The answer is tetralogy of Fallot.